Joining us right now, Kristin Ramsey, Chief Nurse Executive at Northwestern Memorial Hospital. Thank you so much for being here. And we have to talk about the mental health issue with you specifically, but let's first talk about the pandemic. We wanted to kind of get an idea of what it's like where you work. So are you seeing more patients, particularly those with Omicron, at your hospital?
Yes, thank you, first of all, for having me here. We are seeing a rise in our cases, just like about every organization in the country. Omicron is coming into our environment. We are seeing an increase in demand for our emergency room services, in our primary care services, and for our inpatient services.
You know, I was reading the news in Sacramento, and they just received the first two known cases of Omicron. So not everybody that is coming down with this particular strain is going to the hospital. Who are you seeing being admitted? Are they vaccinated? Are they unvaccinated? Are they the highest risk patients?
Yeah, unfortunately, what we're seeing are the unvaccinated patients come in. You know, after all the education that we've provided, all the science that we've provided, it's still the unvaccinated that are requiring the intensive care that the hospitals provide.
And also, it's not just COVID. You're also seeing other people who come in with seasonal respiratory illnesses. What does that mean?
That's correct. We're starting flu season. We're seeing our flu cases increase, other respiratory-borne illnesses. And it's an interesting time of the year because we have patients that are wanting to get regular health care before January when their deductibles start again. So it's a real interesting confluence of many variables that we're seeing now, not only the surge, but other underlying conditions and folks wanting to get their care before insurance starts again.
Yeah, I mean, I did the same thing last year. I'm doing it this year. Just want to wrap up the year on a healthy note. But obviously, there have been issues with being understaffed at hospitals and medical offices. We've been in this pandemic for 2 years. Y'all are tired. What are your biggest concerns right now?
Yeah. You know, the well-being of our staff, I think, is top of mind for everyone in healthcare. Like you reported, we're seeing unprecedented numbers of healthcare providers leave the profession. I think going on a 2-year pandemic with both the professional and personal strains that this pandemic has put upon our healthcare providers is taxing. And I think we're reaching the end of our emotional and physical fortitude to be able to fight this.
And this was happening. I've spoken to nurses here in Illinois who have said that this COVID-19 outbreak, it really just revealed already existing issues with nurses being burnt out and doctors working hours that are just really inhumane in some cases. What can the healthcare industry do to help nurses and doctors right now?
Yeah, I think this is going to reset healthcare. We're going to have to take a pause and really look at how do we provide an environment that healthcare providers can do what they do best, and that's take care of patients. You know, this has really stressed healthcare, and this is not in the United States, this is internationally. And so I think it's going to take a couple of years for us really redefining how we provide healthcare and novel ways to provide healthcare so we don't continue to tax the system and tax our healthcare providers.
And in terms of employee benefits, whether that's pay or time off and other perks that are received in an employment package, what are nurses wanting the most?
Yeah, you know, I think it's the basic needs that have to be met so our healthcare providers can do a good job. It's safe staffing. It's an environment where they can grow and develop. It's being paid well for the job well done. And it's also remembering that there are stressors outside of this organization and personal life. So how do we help them provide work-life balance opportunities?
Yeah, and really counseling is something that I know is something that many people, not just nurses, but many employees are asking for in terms of dealing with the stress of the past couple years or longer. Kristin Ramsey, thank you for being with us.
Thank you. Stay well.
You too. Thank you for that. I like well wishes. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.